This video is about a little gland in your neck and the big impact it may be having on your memory. Many people believe that forgetfulness, confusion, or brain fog after 50 are simply signs of aging, or perhaps early dementia. But what if those symptoms aren't coming from your brain at all? What if they're coming from your thyroid? It's a connection that many doctors miss. Yet research shows that thyroid imbalances can mimic, and even worsen, cognitive decline. According to the American Thyroid Association, both hypothyroidism and hyperthyroidism can affect attention, memory, and mood. And older adults are especially at risk. In this video, we'll explain how your thyroid works, the signs it might be struggling, and what to do if it's affecting your brain. Let's begin. Your thyroid is a small, butterfly-shaped gland located in your neck, just below your Adam's apple. It produces hormones that help regulate your metabolism, energy levels, body temperature, and importantly, your brain function. When your thyroid is working well, you likely won't notice it at all. But when it slows down or speeds up, the effects can be felt throughout your body, including your mind. The most common thyroid issue, especially in older adults, is hypothyroidism. That means your thyroid isn't making enough hormone. And one of the most overlooked symptoms? Memory problems. Mild forgetfulness, difficulty concentrating, slower thinking, even depression and low motivation. All of these can be symptoms of both hypothyroidism and early dementia. That's why thyroid issues are sometimes misdiagnosed or missed entirely. In fact, studies have found that up to 20% of adults over 60 may have some degree of hypothyroidism, and many don't even know it. This is called subclinical hypothyroidism, where blood hormone levels are only slightly off, but the symptoms, especially in the brain, can be noticeable. You might struggle to find words, forget appointments, feel emotionally flat or more anxious than usual. The trouble is, these are often dismissed as normal aging or chalked up to stress, but the root cause could be hormonal. The thyroid hormones, T3 and T4, play a key role in brain metabolism. They influence how quickly your brain cells use energy, how well they communicate, and how efficiently they clear out waste. When your thyroid slows down, so does everything else. Your brain becomes less alert. Your memory retrieval slows. You may feel like you're in a fog, especially in the morning. It's like trying to think through syrup. Even your mood can be affected. Low thyroid function has been linked to depression, irritability, and apathy, emotional states that can further cloud cognitive function. And in older adults, these symptoms may appear gradually. You may not notice a big change all at once, but slowly, you might feel off. Here's where it becomes especially important. Several studies have suggested that untreated hypothyroidism in older adults may increase the risk of cognitive decline and even dementia over time. One large study published in JAMA Neurology found that individuals over 65 with low thyroid hormone levels had a significantly higher risk of developing dementia, especially when the condition was not treated. But there's good news. When caught early, thyroid-related memory issues can often be reversed. Treating the underlying hormonal imbalance may bring significant improvements in focus, mood, and memory. That's why thyroid testing is such a crucial step when memory problems arise, especially if you're over 50. So how do you know if your thyroid might be the issue? Here are some common signs of hypothyroidism to look out for, especially when they appear alongside memory changes. Fatigue, even after a full night's sleep. Cold hands and feet, weight gain without a clear reason, dry skin and thinning hair, hoarseness, constipation, depression or low mood, trouble concentrating or remembering things, puffy face or swelling in the neck area. Not everyone will have all these symptoms, and they may come on gradually. But if you're experiencing several of these, particularly memory issues with no clear cause, it's worth getting your thyroid checked. A simple blood test called TSH, thyroid stimulating hormone, is usually the first step. If your TSH is high, it may mean your thyroid is underactive. Doctors may also check levels of free T4 and sometimes T3 to get a clearer picture. If results come back abnormal, your doctor might suggest a small daily dose of levothyroxine, a synthetic form of thyroid hormone. This can help restore normal hormone levels and improve brain function over time. But even if your levels are technically normal, you can still feel off. That's why it's important to discuss symptoms thoroughly, not just rely on lab numbers alone. Sometimes memory problems aren't caused by the thyroid itself, but by autoimmune thyroid disease. Conditions like Hashimoto's thyroiditis can cause both thyroid dysfunction and subtle inflammation that affects the brain. In these cases, even before hormone levels drop significantly, symptoms like brain fog and fatigue may appear. That's why it's worth asking for a full thyroid panel, including thyroid antibodies, if you suspect something's wrong, but your basic labs are fine. Let's summarize. The thyroid plays a key role in brain function. Low thyroid hormone can cause memory problems, brain fog, and low mood. These symptoms often mimic early dementia. A simple blood test can identify thyroid issues. With treatment, cognitive symptoms can often improve. Once a thyroid imbalance is properly diagnosed, treatment can make a significant difference, not just physically but mentally and emotionally as well. For those with hypothyroidism, the most common treatment is a daily dose of levothyroxine, which replaces the hormone your body isn't making enough of. Over the course of several weeks to a few months, people often notice clearer thinking, improved memory, better mood, more consistent energy, and, less fogginess, especially in the morning. But improvement is not always instant. The brain needs time to recalibrate, and for some, especially older adults, symptoms may improve gradually and subtly. What's important is giving the treatment time to work and ensuring follow-up testing is done to keep hormone levels in the right range. Unfortunately, thyroid problems are often missed in people over 50. Here's why. Many symptoms, like fatigue, weight gain, slower thinking, or depression, are commonly assumed to be just part of normal aging. Doctors may focus on managing mood or memory issues without ever checking thyroid levels. In fact, in one study of older adults experiencing cognitive complaints, nearly 1 in 10 were found to have undiagnosed thyroid dysfunction. That means they were living with potentially reversible symptoms without knowing why. To make matters more complicated, standard thyroid test ranges were developed using younger populations. So, what's considered normal might not be ideal for someone in their 60s or 70s. That's why it's really critical to advocate for full thyroid testing if you're experiencing unexplained cognitive decline. You know your body better than anyone. If something feels off, it probably is. What if your thyroid tests come back normal, but you're still dealing with symptoms? This is a really common and honestly pretty frustrating situation. Sometimes your TSH level might fall within the normal lab range, but it's actually on the higher end. This is often called subclinical hypothyroidism. In some cases, treatment is still considered, especially if you're struggling with brain fog, a low mood, or memory concerns that are affecting your daily life. According to the American Academy of Family Physicians, treatment for subclinical hypothyroidism may be appropriate in older adults if symptoms are present and persistent. Another important test in these cases? Thyroid antibodies. If you test positive for antibodies, it may mean your immune system is attacking your thyroid, a condition called Hashimoto's thyroiditis. Hashimoto's can cause your hormone levels to fluctuate, which can really confuse both your body and your brain. And honestly, early treatment, along with regular monitoring, can help prevent symptoms from getting worse. Medication is often essential, but there are also lifestyle factors that support both thyroid function and cognitive clarity. Here are a few evidence-backed steps. First, eat enough iodine and selenium. These minerals are crucial for thyroid hormone production and activation. Iodine is found in iodized salt, seafood, and dairy, while selenium is in Brazil, nuts, eggs, and whole grains. Next, avoid over-restrictive diets. Very low-calorie or low-carb diets can suppress thyroid function, so make sure you're eating enough, especially if you've been trying to lose weight. Also, watch for soy and cruciferous vegetables. In large amounts, raw soy and veggies like broccoli and cabbage can interfere with thyroid hormone absorption, especially if you're low on iodine. Cooking usually minimizes this effect though. Managing stress is also key. Chronic stress raises cortisol, which can suppress thyroid function, so gentle activities like walking, meditation, or even gardening can help regulate your stress response. And don't forget about sleep. Regular sleep helps balance hormones, repair brain tissue, and regulate your mood. Aim for 7 to 9 hours each night in a cool, dark, quiet room. Avoid smoking since it affects thyroid function and blood flow to the brain. Quitting may improve both memory and metabolism over time. And finally, monitor medication interactions. Some drugs, like calcium supplements, antacids, or iron, can interfere with thyroid medication. It's best to take thyroid meds on an empty stomach and wait 30 to 60 minutes before eating or taking other pills. If you've noticed changes in your memory, energy, or mood, and especially if you're over 50, don't just assume it's just aging. Ask your doctor to run a complete thyroid panel including TSH, free T4, free T3, and thyroid peroxidase antibodies, or TPO-AB. Even if your thyroid isn't the full cause, testing helps rule out a common and treatable contributor to cognitive decline. And if your thyroid is the issue, addressing it can bring real, meaningful relief. You might just feel more like yourself again. Thyroid issues are actually one of the most underdiagnosed causes of brain fog, fatigue, and memory problems in older adults. The good news? They're also one of the most treatable. So if you've been feeling slower lately, mentally or physically, don't just ignore it. You really don't have to settle for forgetfulness, sadness, or foggy mornings. There may be a medical reason, and there may be a way forward. Your memory matters, your clarity matters, and your thyroid just might be the missing piece. Thanks for watching Silver Memory. Stay curious, stay informed, and take good care of your brain.